I thought that I would talk about a current trend regarding breast implants. Many women who had breast implants placed in their 20s, early 30s, time has gone by, they've had children, and now they're in their late 40s, 50s, even 60s. Patients, for the most part, are wanting to remove their implants when they've had their implant for a very, very long time. Implants are supposed to be changed out, removed within a 10-year period, and many women have even forgotten they have breast implants, and they've expended 10, 20, almost 30 years at times with the same implants. This is not beneficial to the patient. We want to make sure that the patients out there realize that implants are not forever, and that at some point or another, these implants must be changed. There is, however, options that we can talk about. Breast lifts without the implants, removing the implants altogether, or we can talk about doing breast lifts and exchanging the implant. This will all depend on what the patient desires as the end result. Frequently, patients who've had their implants in for a long period of time will often develop what's called the capsular contracture. First of all, you need to know what a capsule is, right? Whenever we put a foreign body into the body looks at it and it's foreign. So our immune system develops an envelope around that implant. That envelope, or that covering of very, very thin tissue, is called the capsule. At some point or another, that patient may go on to develop an inflammatory reaction of the capsule. Remember, the capsule is living tissue. So the diameter of the implant, that's not going to change. The tissue that surrounds it, if it gets a stimulus that causes an inflammatory reaction, the diameter of the capsule starts to contract around that implant, and therefore it can make the breast firm, or in some cases hard. And that may become bothersome, and it might look distorted. At that point, a woman can come to the office and we can discuss the options that she may have, either removing them altogether, getting the capsule out or that scar tissue out, lifting them, exchanging them, or taking them out altogether. Whatever the goal is for that particular patient.